Don't worry.
I normally don't bother much about this.
Okay.
Should I start?
Yeah, yeah.
Hi, everybody. I'm Dr. Vandana Sodi. I'm a senior consultant in obstetrics and gynecology and an advanced laparoscopic gynae surgeon. Today, I'm here to talk to you about a common problem in pregnancy, but which can be a very complicated problem at times. And this is known as hypertension in pregnancy. Hypertension in pregnancy, we must all understand, is something very different from hypertension in any normal individual who's not pregnant, as it has its own set of complications which have to be managed and tackled in a totally different scenario. Let us start with a few things which all of you should know. Firstly, that you must always regularly go for antenatal checkups where your doctor will check about your blood pressure, she'll check your weight, see if the baby's growth, listen to the baby's heartbeat. BP checking and monitoring are a routine part of a regular antenatal checkup. Now, if at any stage during your checkup the blood pressure is found more than 140 systolic by 90 diastolic, that is the time that the alarms are raised, because any blood pressure which is more than 140 by 90 is not good for pregnancy. However, hypertension in pregnancy has different settings during pregnancy. It could be that a person is chronically hypertensive and she has conceived while she is hypertensive. The second scenario could be that she has gestational hypertension. That means she has developed pregnancy, but the complications are lesser. And the third is, of course, which is known as pregnancy induced hypertension or preeclampsia. Here we need to know that if you are already a hypertensive, then you need to tell your doctor about the medications that you're taking during pregnancy. These medications at times would have to be changed because some of them are contraindicated during pregnancy. Your doctor will be able to tell you as to which of these medications are to be avoided during pregnancy. If a high blood pressure is found on a single reading during pregnancy, we definitely would want to monitor that after another couple of hours, maybe 4 to 6 hours. And even after that, if the blood pressure is on the higher side, then treatment and medication and precautions need to be followed. Now, what all things we need to know when a BP is high? We need to know that you should not be having any other symptoms of high blood pressure. These symptoms of high blood pressure could include headaches or dizziness, which could also include blurring of vision. It could include a pain in the upper abdomen. It could also include a reduced amount of passage of urine. It could also have been presented with vomiting. These are the symptoms which would alert us and tell us that the blood pressure may not be under control and would require further medication during pregnancy. Hypertension in pregnancy occurs in about 5 to 8% of women, and if not looked after or not picked up and treated, it can lead to life-threatening complications for the mother. The complications can also be for the baby in the form of growth restriction as well as intrauterine demise at times, which none of us definitely want. Now, a few things that we all need to know is that few precautions need to be taken when your blood pressure is on the higher side. And these precautions need to be a little bit of bed rest, eating right, taking your medicines on time, and going for regular checkups. The symptoms, which are the alarming symptoms, have already been told to you. I would like to repeat them once again, that headaches, blurring of vision, vomitings, pain in the upper abdomen, passage of less amount of urine, decreased fetal movements. If any of these things happen once your blood pressure has been noted to be high, then definitely you need to consult your doctor. During the investigations, a couple of blood tests and other investigations are done to see the severity of the hypertension. That could include your blood tests like counts, platelet count, liver function test, and a renal function test. These tests would tell us how bad the pregnancy hypertension is. The other things that we also need to notice is if you develop swelling of the feet and the face and the abdominal swelling, that also needs to be paid cognizance to, because these features are also indicating the fact that you could be landing up in a severe hypertension. Now, after monitoring the blood pressure and giving you medication and monitoring your urine and other blood parameters, if the blood pressure does not come under control, then definitely the definitive treatment for pregnancy-induced hypertension would be delivery. The definitive treatment is delivery. With medications, we try and reach a point where the baby is also self-sufficient to breathe at delivery. That means we try and avoid a preterm delivery. So if the blood pressure is under control and the mother's health is stable, then as soon as maturity of the baby is reached, which we all take the world over as 37 weeks, then an induction of labor can be and a delivery is planned. But if the mother's condition is not stable and her blood pressure is not coming under control, to prevent the maternal complications, a preterm delivery could also be warranted. That is why pregnancy-induced hypertension or hypertensive disorder in pregnancy has to be taken, has to be paid attention to. It has to be taken with utmost importance and not neglected at all. Now coming to why this happens. This can happen because of varied reasons. The main reason is that there are some problems during the placentation process when the baby is implanted inside. That is the time when a little bit of placentation process is there, which could be a little different from a normal pregnancy, which could lead to changes which lead to pregnancy-induced hypertension. These changes also affect the growth of the fetus. The fetus can have a restricted growth since the blood supply and the oxygenation which is going to the baby are not the way it should be. It could affect the growth of the baby also. So, parameters and medications which need to be given to help this are also started along with. Ultrasounds are done on regular basis to see the fetal growth restriction is not setting in and the baby's growth is good too. If the blood pressure is very high, that means it is beyond 160 and the diastolic is beyond 110, touching up to 120 at times, then the maternal health takes priority over everything. However, as a doctor, we need to be sure that the baby also thrives. So a very balanced decision has to be taken by a doctor here. Whenever a blood pressure is not coming under control with medication also, then a delivery has to be planned, as that is the definitive mode of management of this condition. And then a counseling is required because the baby may require the nursery care because of prematurity. So there are so many things which I have told you right now, and all these things I hope have not muddled you up. Just putting things very clear, step by step, is that firstly, pregnancy-induced hypertension has to be taken seriously. It is not to be just discarded. It doesn't matter BP is high. No, it can have changes which can affect you and your baby in an adverse manner. Second thing is, it has a treatment. That means it is not something which can't be treated. If picked up on time, there are medications to control your blood pressure. These medications are safe in pregnancy. And once these medications are started, blood pressure monitoring is done routinely, then things can be planned out in a more methodical manner. Blood pressure during pregnancy should be remaining at the blood pressure during pregnancy, we try and maintain it at about 140/90 with medication also. Ultrasounds are done routinely so that the baby's growth is monitored. Timely delivery will have a healthy mother and a healthy baby. So, all you folks there, don't worry about this. This can be managed, but remember to go for your regular antenatal screenings and antenatal checkups. Once there is pregnancy-induced hypertension, then you need to be sure that you attend your regular antenatal checkups with your doctor. Don't forego them or miss them, because as I said, if not taken care of, it can land up in serious complications. Don't get scared, but then follow the method. Any questions? If there are any questions regarding this, all of you can just send your messages and we'll answer all of them. I've made it very brief and short and in a very simplified manner so that everyone there knows what has done and what has to be done in a systemic manner. It's not to scare you. It is not to run away from the doctor. It is just to ensure that you must visit your doctor regularly for antenatal checkups, because the smallest of things can become big and become uncontrollable. Are there any questions? I would like to answer them.
Is preeclampsia and hypertension the same thing?
Preeclampsia and hypertension in pregnancy preeclampsia is a type of hypertension in pregnancy. Hypertension in pregnancy, as I mentioned earlier, the hypertension could be a chronic hypertension or it could develop during pregnancy. When a pregnancy-induced hypertension happens more so after 20 weeks, that means 5th month of pregnancy, when your blood pressure is detected to be high, that is the time we label it as preeclampsia. Plus it has urinary changes also, where proteins are present in your urine. I hope the answer is clear. Hi, who's that?
My wife is a BP patient. Is it okay to take BP medicine during pregnancy?
Yeah, who's the patient?
Rohit.
Achha. Hi, Rohit. Your wife has hypertension in pregnancy. Yes, that's a question. Yeah. So yes, there are safe medicines in pregnancy which can be given to control the blood pressure. But then the doctor has to decide as to how much is the reading and when one needs to intervene. Because it is not for every hypertension in pregnancy that you need to start the medications. And I said there are safe medications other than those which a non-pregnant patient would be taking. I hope I'm clear about that. Patient's name?
Gunjan.
Hi, Gunjan.
What should I do to reduce hypertension during pregnancy?
What should you do? Maintain a healthy lifestyle. Do a little bit of exercise. Eat right. Don't stress yourself out. And drink a lot of water. And these changes will would not really stop a hypertension from developing if the placentation is bad, but it could to some extent help in controlling the rise in the blood pressure. Obesity, pre-pregnancy obesity also should be controlled, which could also be a contributory factor towards development of hypertension. There are different contributory factors for developing hypertension, and one of them could be obesity, and a pre-existing disease, like diabetes also, could lead to pregnancy-induced hypertension during pregnancy. So also the chances of developing hypertension is higher with multiple pregnancies than with a singleton pregnancy. Who's the patient?
Anita.
Anita. Yeah, Anita, I've seen your question.
6 months pregnant and I get a lot of anxiety attacks. Please advise how to handle it.
Anita, your question says about, it talks about anxiety attacks. See, the anxiety could be related to stress and nothing else. And one has to learn to de-stress oneself, do some yoga every day, do some physical activity every day, make sure the environment in your home is good and you have support of your family. Then the stress and the anxiety attacks would definitely be reduced. And I think you should talk to your doctor about this, definitely. Any other questions?
Any special precaution to prevent hypertension?
Who's this?
Mahima.
So, special precautions, as I said earlier, if you have a healthy lifestyle pre pregnancy, then complications which develop during pregnancy are much lesser as compared to a non healthy lifestyle being followed prior to getting pregnant. So, that would entail regular physical activity and regular walks. Eating right is very important. In today's world, we are in a stressed out life. We are working, we are from morning to evening, we're just running around, working, and not looking after ourselves. And we tend to just pick up and eat whatever comes our way. So we need to definitely curb that, and we need to see that we eat right, eat healthy, so that the body metabolism remains good. And once that happens, then definitely whatever changes that take place during pregnancy would not really be adverse. Yes. If there are any questions, any further questions, all you young ladies there, come on, ask questions.
That's it.
Yeah. So I think we would like to conclude here, and thank you for joining us and being part of this small little session where we try to educate you a little bit about one of the problems during pregnancy. And one thing I would like to highlight here is that WHO has said that if we see the data that the maximum deaths which take place due to maternal mortality which happens or morbidity which happens, and one of the contributory factors, about 12%, is preeclampsia or pregnancy-induced hypertension, because it is not taken care of. These are world data and not Indian data. So one would definitely re-emphasize the fact that take care of yourself, go to your doctor regularly, get your blood pressure checked every visit, and listen to her and follow us. Thank you.